Hola, feliz viernes, yo soy Rory, hoy es viernes y estoy contento de estar de vuelta aquí con ustedes. Well, today's Friday, I'm glad to be back with you, and today we're talking dolor y examen de la rodilla en español. And this topic has some vocabulario that you're going to want to know and a few helpful tips for talking about the history of knee pain, when it started, how it happened, etc., and talking through some physical exam things, different images and tests possibly to diagnose, and then common diagnoses for these knee injuries. So thanks for joining me today. There are a few complicated terms in here, so I actually even had to make notes in English because I wasn't 100% familiar with some of this stuff. So anyway, if I botch it, just put a comment in there and say, hey Rory, you screwed this up. All right, muy bien, gracias. Vamos a continuar con anatomía. Anatomía de la rodilla. Tenemos cartílago articular. So, cartilage, right? Articular cartilage. El fémur, with an accent. The image actually on the first page, I didn't get it off to our designer with proper spelling, so my bad. Okay, el femur. El hueso, bone. Y el ligamento anterior cruzado, so ACL, anterior cruciate ligament. See? I didn't mean to swear right there. El ligamento lateral colateral. Okay. Ligamento posterior cruzado. El meniscus, ¿verdad? El peroné. Peroné is fibula, ¿sí? El hueso en la pierna. El tendón del cuádriceps, ¿sí? Tendón del cuádriceps, so the quadriceps tendon. El tendón rotuliano, so the patellar tendon. La banda iliotibial, so the IT band, iliotibial band. Y la pierna, leg. La rodilla, knee. La rótula, kneecap or patella. La tibia. Y los músculos cuádriceps. Perfecto. Mucha anatomía. Remember that all this is in our Learning Medical Spanish group to download the notes here, so you can just make notes quickly. You don't have to write it all, ¿verdad? Okay, vocabulario. Now, signos y síntomas of problemas. Primero, bloquearse. Bloquearse es el verbo the locking, ¿verdad? Calor, heat or hot. Cederle. So, le cede la rodilla. And it's kind of, ceder is the verb to yield. And so we would use this in the context of, does your knee give way, right? Or give out. Chasquido, clicking. Crujir or truenar, ¿sí? This would be popping. Doblarle, se le dobla la rodilla. Does it buckle on you? ¿Sí? Se le dobla. This is that se le, that se imprevisto. You've heard maybe before, oh, se me olvidó, I forgot. Or se me cayó, something fell. Basically, I dropped it. But this is that se imprevisto, and so it's something that happens that you're not expecting. So se le dobla. Does it buckle on you, ¿verdad? Dolor agudo, sharp pain. Dolor cuando camina, pain when you walk. Dolor or estar adolorido. So dolor, pain. Estar adolorido is to be sore or to be tender. And so you would use la rodilla duele mucho o está adolorido, etc. Dolor fuerte, a strong pain. Dolor sordo, dull pain. Some people will use, by the way, about fuerte, some people use dolor fuerte for a sharp pain as well. So keep that in mind. Hinchazón, swelling, edema, right? Or fluido, ¿verdad? Fluid. No pudo continuar or tuvo que parar su actividad. And so one of the questions as you're talking about what happened with the knee might be, were you able to continue your activity or did you have to stop? And so no pudo continuar. You couldn't finish. Tuvo que parar su actividad. You had to finish your activity or stop your activity. Rango, no puede poner peso, cannot bear weight on your leg or knee. Rango de movimiento limitado, so limited range of motion or range of movement. Rigidez, rigidity. Okay? Bien. Continuamos con más vocabulario útil. There's just a ton of vocabulario around the knee and figuring out knee pain. So let's move into la historia un poquito. La historia. ¿Alguna vez ha tenido este dolor o este problema antes? Have you ever had this before? ¿Y qué pasó? What happened? Be careful with that question, right? So if you're a beginner, that's going to be really tough to follow because it's a very open-ended question. ¿Qué hacía cuando empezó? What were you doing when it happened? And if you think back to our uses of preterite and imperfect in Spanish, we've got imperfect, what was going on. Cuando empezó, when that interrupting action happened. Cuando empezó implied here when the pain started or when whatever problem we're talking about started. So, ¿qué hacía? What were you doing cuando empezó? You could use that question in a variety of contexts, right? When your shortness of breath or chest pain or anything else began, right? ¿Escuchó algún crujido o chasquido? Did you hear any popping or clicking? ¿Con qué frecuencia? How often? Or cada cuánto, another common way to ask the question, how often do you have X, Y, or Z symptom? Okay, now let's talk about timing, because we've got con qué frecuencia and cada cuánto. So let's get a little more specific about the timing of this problema. So, con timing. Posiblemente, getting back to the qué pasó, cambiar dirección, changing direction. And another way to talk about that in English would be to cut right or cut left. Someone playing a sport and they cut, juke, right? So cortarse a la derecha o a la izquierda. Yo me corté a la derecha, I cut to the right, or me corté y sentí el dolor. Cuando corría, when I was running, or when you were running, right? Same. Dar vuelta, turning around, to turn around. De repente, inmediatamente, suddenly or immediately. El próximo día, the next day. Parar rápidamente, another one of those motions that could cause knee pain or knee injury, right? Stopping fast or stopping quickly. Saltar y aterrizar, jumping and landing. Saltar y aterrizar. And unos días después, so a few days later. So here we've got maybe how it happened or what we were doing and a little bit of información around the timing of it, suddenly, slowly, etc. Okay, aún más vocabulario, starting off with para diagnosticar. Well, we have examen físico, ¿verdad? Y tenemos imágenes por resonancia magnética, so MRIs or IRMs en español. And by the way, with those kinds of abbreviations, it's usually best to use the English abbreviation or the English acronym, because that's most likely how patients will navigate your clinic or your hospital, right? So if you talk about IRMs, because it's imágenes por resonancia magnética, but all they see are signs and paperwork that says MRI, then that's less than perfectly clear for them. And so maybe you just talk about MRIs, because that's how they navigate your space. Think about it anyway. Think about your setting and what would be most useful, actually using the acronym in Spanish or using it in English. It wouldn't be a problem if you used it in English, basically is what I'm saying. Okay, radiografía, x-rays, tomografía computada, CT scan. Okay, now unos análisis de sangre, not necessarily with the sports injury, but some other problems that could come up or could be causing knee pain. ¿Verdad? So arthrocentesis, Recuento sanguíneo total. So a complete blood count, right? A CBC. Velocidad sedimentación globular. This was one I had to write down. So, erythrocyte sedimentation rate. Okay, bien. If you don't know what that is, don't worry about it. If you do know, that's how you say it. All right, so frases para el examen físico. So as you get into your examen con el paciente and you need to orient them, tell them what you're doing and ask them to do a few things, here are some things you might want to ask or tell. So first of all, ¿le duele cuando palpo o toco aquí? Does it hurt when I touch or palpate here? Acuéstese, lie down. Acuéstese boca arriba. Remember, mouth is our reference, not belly and back. So, acuéstese boca arriba means lie down on your back. Y voy a doblar la rodilla. I'm going to bend your knee. Relaje la pierna, por favor. Relax your leg, please. Dígame si algo le duele. Tell me if something hurts. Okay, bien. Y con el examen de la rodilla, at least what I saw online, again, you know that I'm not a practitioner, but from what I saw online, it didn't seem like there was a whole bunch of resistance type testing like we would do for the painful shoulder exam, that it was mostly positioning and seeing how loose or strong something was. So the knee is. So anyway, if I'm missing something, put some comments down here and I'll be glad to add some additional questions or instructions for you here in the exam portion, okay? Unos imágenes posibles. Getting back to some of those images, we already talked about radiografía y tomografía computada. We've got rayos X y radiografía, okay? And TAC, tomografía computada. IRM, imágenes por resonancia magnética, right? And so that's what we're dealing with, these types of exámenes. Here are some possible frases that might be useful as you're telling patients about getting these, okay? Vamos a hacerle rayos X para ver la rodilla mejor, para ver el hueso, para ver si el hueso está fracturado, ¿sí? To see if the bone is fractured. Quisiera pedir, I'd like to request or add or ask for or order, quisiera pedir un TAC para ver la rodilla mejor. Con la radiografía no podemos ver muy bien los tendones y ligamentos. Yo quisiera pedir una tomografía computada para ver los ligamentos mejor, ¿sí? Okay, diagnosis posibles. Now remember, there are other problemas besides ACLs and otros ligamentos tendones, right? Hay posibles infecciones en la rodilla. So, arthropatía inflamatoria. Arthropatía inflamatoria, this is one I had to write down also. So, acute inflammatory arthropathy, okay? Arthritis reumatoide, rheumatoid arthritis. Arthritis septic arthritis. Bursitis, a quick explanation of bursitis would be una inflamación de la bursa. Es un saco de fluido entre los huesos que ayuda el movimiento de la rodilla. Okay, it's a small sac of fluid between the bones or in between the bones that helps movement in the knee. Una dislocación. Otra posibilidad, fractura. Gota, gout. Herida o lesión en el ligamento. So any herida and lesión are both great words for injury. So herida o lesión en el ligamento, ligament, el tendón, tendon, or el hueso, the bone, ¿verdad? Problema con la banda iliotibial. So any kind of problem with the IT band. Mi esposa Leslie tiene problemas con la banda iliotibial. Tendón, ligamento roto, estirado o desgarrado. Okay, now roto can be used for hard objects like huesos, but also is the best word for soft tissue to mean torn. Okay, so tendón, ligamento torn, ¿verdad? Estirado, stretched, or desgarrado. Desgarrado would be detached, okay? Desgarrado. Tendonitis, otro problema. Tendonitis, inflamación del tendón a causa de movimientos repetitivos por mucho tiempo o por una herida aguda. ¿Sí? So, tendonitis, an inflammation of the tendon because of repetitive movements over time or because of an acute injury, ¿verdad? Ok, ahora hablamos tratamientos posibles. Tratamientos posibles para la rodilla. Tratamientos posibles, if we have algún tipo de infección or itis or something, posiblemente antibióticos para curar la infección. Antiinflamatorios para bajar la inflamación. ¿Okay? Cirugía para reparar el ligamento o reparar el tendón, etc. Escayola or yeso para inmovilizar la rodilla. Now, escayola, yeso, two good words for a cast. All right? So we've got antibiotics, anti-inflammatories, surgery, escayola, cast, reposo, rest, para que la rodilla descanse, so the knee can rest. Now, notice, you know that descansar is an AR verb, but I put descanse here. That's because there's a que. Para que la rodilla descanse. And that's one of our triggers for subjunctive. Para que. Remember, in most cases, you can opt out of the que and use your verb in the infinitive. Para dar tiempo a la rodilla descansar y repararse. Okay? But as soon as you say para que, now you know that's a trigger for subjunctive. Okay. That matters to everyone who's kind of upper intermediate and advanced. Below that, don't worry about it, okay? Bien, it'll come with time. Rodillera, a knee brace, para estabilizar la rodilla, okay? Y terapia física, para fortalecer la rodilla y la pierna. All right, muy bien. Well, if you're on the email list, you know that this is my last Video Viernes lesson of 2017. As I move into December, well, it's the first day of December now, but as we move into the month of December, I need to really focus on our medical Spanish immersion programs this winter in Nicaragua and Costa Rica. There's a ton of coordination that we do for those, and it doesn't happen automatically. So a lot of that falls to me, and that's what I'll be working on full time, basically, this month of December. So I won't see you this month, but if we don't have any communication over email or Facebook, or you don't give me a call, muchas gracias. Thanks for joining me this year. Feliz Navidad. And I look forward to seeing you in the new year. Mi familia, tenemos una tradición. Siempre vamos a las montañas después de Día de Acción de Gracias y cortamos un árbol. Es increíble, es un día para caminar en el bosque y tener tiempo como familia. So, aquí estamos, el árbol está puesto, es alto. Pero y no es muy lleno el árbol. It's not very full. Pero es natural. Me gusta. All right, muy bien. If you're looking for some more opportunities to work on your Spanish in the downtime, take a look at the website, commongroundinternational.com. Share this Facebook group with your friends. Post your questions, your requests here in the group, and I'll be glad to answer those throughout this month. But I'll look forward to seeing you in the new year. Hasta luego! Hey, thank you for joining me today on this Video Viernes lesson. I wanted to invite you to join our community if you're not a member of the Facebook group already, that I deliver these live lessons in on most every Friday. And also point you to the website where you can find a bunch more information about medical Spanish, whether that be courses or free materials for you, or finding a private tutor to work with you online or face-to-face. And also let you know about some amazing Spanish immersion programs, either you as a medical person or your significant other as working in some other industry, or your family. If you want to improve your Spanish and you have time and budget to go do some travel, our programs are pretty amazing. I think it'd be fun to work with you. And finally, if you have some document work at your clinic or at your hospital or within your setting that needs to be professionally translated, shoot me a message, upload your document to us, and we can get you a quick quote and help you out with your Spanish language documents as well. Have a great day.